Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Menopause. Effects of low estrogen levels. Introduction. Menopause marks the end of a woman's menstrual period. Her ovaries stop making estrogen and progesterone. Menopause usually happens between 40 and 55 years of age. Lower levels of estrogen can lead to uncomfortable symptoms such as hot flashes, memory problems, sexual problems, and physical changes. Many effective treatments are available, from lifestyle changes to hormone therapy. This program explains menopause and the effects of low estrogen levels. Anatomy of female reproductive system. The female reproductive organs include the ovaries, the fallopian tubes, the uterus, the vagina. The female reproductive organs are located in the pelvis between the urinary bladder and the rectum. The ovaries are glands that are part of the female reproductive system. They have two main functions: the production of specialized hormones such as estrogen and progesterone, which regulate the menstrual cycle; ovulation, which is the release of eggs needed for reproduction. The levels of estrogen and progesterone increase before and after ovulation. If the egg is not fertilized, hormone levels decrease and menstruation begins. Menopause and low estrogen. A woman has reached menopause when she has not had a period for 1 year, but changes and symptoms of menopause can start several years earlier. A woman's ovaries start making less estrogen and progesterone in her late 30s. A woman may experience symptoms when estrogen and progesterone levels change. There are 3 stages of menopause. They include 1. Perimenopause, when a woman's body begins to make its natural transition toward permanent infertility. 2. Menopause, which is the permanent end of menstruation that is not caused by any medical treatment. 3. Postmenopause, the phase that includes all the time after menopause. Due to decreased estrogen levels, menopause symptoms may still happen during this stage. Changes in your period are a sign of perimenopause. Periods may become lighter or heavier, shorter or longer, more frequent or less frequent. Other symptoms of low estrogen levels during the stages of menopause may include hot flashes, trouble sleeping, and night sweats. Other symptoms include mood swings, trouble focusing and memory problems, fatigue, headaches. Symptoms may also include joint and muscle stiffness or pain, thinning hair, facial hair growth. During the stages of menopause, your feelings about sex might change. You might have trouble becoming sexually aroused due to low estrogen. You might feel freer and sexier after menopause. You may be relieved that pregnancy is no longer a worry. Until you have gone 1 year without a period, you should continue to use birth control if you do not want to become pregnant. Practice safe sex with any new partners. You can still get sexually transmitted diseases after menopause. Body tissue in the genital area becomes dry and thin as estrogen levels change during menopause. Sexual intercourse might become painful because of this dryness. You may be more likely to have vaginal infections. Menopause also may cause weight gain in the waist area, loss of muscle mass and increase of fatty tissue, thinning and loss of stretchiness in the skin, reduction in breast size. Menopause can weaken your bones. This condition is called osteoporosis. Osteoporosis can lead to bone fractures. Low estrogen levels during menopause means that bone strength could be lost even faster. As estrogen levels go down during menopause, older women may tend to have higher cholesterol levels. High cholesterol increases the chance of heart disease. After menopause, a woman's risk of heart disease rises greatly. Stroke. Other diseases that affect the heart and blood vessels. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Diagnosis. Seek treatment for menopause symptoms if they interfere with your life. Lifestyle changes and medical treatments can help. Your healthcare provider will help you stay healthy in this stage of life. Based on your medical history and family history, he or she may suggest ways to help prevent osteoporosis, breast cancer, and heart disease. Hormone level changes can be detected through blood and urine samples. They can help your healthcare provider identify whether you have been through menopause or are approaching it. Your healthcare provider may perform a pelvic exam to look for changes in the vaginal tissue. Lifestyle changes and treatment options. If the symptoms of menopause bother you, talk with your healthcare provider about treatment options. He or she can also help you avoid common problems that happen as women age. Your healthcare provider might prescribe birth control pills. These will prevent pregnancy. During perimenopause, there is still a slight chance you may become pregnant. Make your periods more regular. Lower your chance of ovarian or uterine cancer. Birth control may also reduce symptoms like hot flashes. Talk to your healthcare provider about when you can stop taking the pill to prevent pregnancy. He or she may recommend you use a different birth control method during this time, such as condoms. Your healthcare provider may suggest a combination of estrogen and progesterone supplements to treat menopause symptoms. This is known as hormone replacement therapy, or HRT. For women without a uterus, your healthcare provider may recommend estrogen alone. This is called estrogen replacement therapy, or ERT. HRT and ERT can help reduce the risk of fractures due to osteoporosis, colon cancer, hot flashes. The combination of estrogen and progestin may increase the risks of heart disease, stroke, blood clots in the lungs or legs, breast cancer. Phytoestrogens are estrogen-like materials found in cereals, vegetables, beans, and some herbs. They may work in the body like a weak form of estrogen. Some may lower cholesterol levels. Some plant estrogens, such as soy, wild yams, and certain herbs, are thought to help relieve the symptoms of menopause, but more research is needed to determine their effectiveness and safety. If you decide to eat more foods with phytoestrogens, be sure to tell your healthcare provider. Any food or over-the-counter product that you use for its drug-like effects could interact with other prescribed drugs or cause an overdose. Certain medications can help reduce hot flashes in women who can't use estrogen therapy. There could be a connection between changes in your estrogen level and your emotions. You may feel anxious or depressed during menopause. Exercise and meditation can help reduce stress. Avoiding or reducing caffeine may also reduce stress and sleep problems. Make time for things you enjoy, such as reading, painting, or bicycling. Talking to a partner, friend, or therapist can also help you cope with emotional stress. Sometimes an antidepressant can help relieve hot flashes, especially in women who need to take medication for depression. This is mostly for women who cannot take estrogen. To keep hot flashes from waking you up during the night, sleep in a cool, well-ventilated room. Wear light-colored clothing made of natural fibers. Use sheets and clothing that let your skin breathe. Feeling tired is a common symptom of menopause. You might have trouble getting to sleep, waking up early, or getting back to sleep after waking up in the middle of the night. If you have not slept well at night, try taking a nap during the day. Getting plenty of calcium and vitamin D before and after menopause can lower the risk of osteoporosis. Dairy products are a good source of calcium and vitamin D. Healthcare providers also may recommend medications. Medications can lower your risk of bone fractures. Exercise may also keep muscles and bones strong and reduce the chance of falling and breaking bones. 30 minutes of weight-bearing exercises like walking, jogging, or weightlifting 3 days a week or more can help prevent osteoporosis. To reduce your chance of heart disease, eat a healthy diet that includes fruits, vegetables, and whole grains. Do not smoke. Maintain a healthy weight. Exercise regularly. Vaginal tablets, creams, or rings that provide estrogen directly to vaginal tissues can help reduce dryness and some urinary problems. Water-based lubricant can also help prevent vaginal dryness during sex. Your skin may become dry and more wrinkled due to menopause. Your hair may become thinner. Facial hair may also grow on the upper lip or chin. Before deciding on any form of treatment for menopause symptoms, talk with your healthcare provider. Have a conversation every year or so about the potential risks and benefits of your treatment options. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Menopause marks the end of a woman's menstrual period. Her ovaries stop making estrogen and progesterone. Menopause usually happens between 40 and 55 years of age. A woman has reached menopause when she has not had a period for 1 year, but changes and symptoms of menopause can start several years earlier. A woman's ovaries start making less estrogen and progesterone in her late 30s. A woman may experience symptoms when estrogen and progesterone levels change. Changes in your period are a sign of menopause. Periods may become lighter or heavier, shorter or longer, more frequent or less frequent. Symptoms of low estrogen levels during the stages of menopause may include hot flashes, trouble sleeping, and night sweats. If the symptoms of menopause bother you, talk with your healthcare provider about treatment options. He or she can also help you avoid common problems that happen as women age. Your healthcare provider will help you stay healthy in this stage of life. Based on your medical history and family history, he or she may suggest ways to help prevent osteoporosis, breast cancer, and heart disease. Thank you for using Explain.